I've got to get over here where I can board. I can't see it.
Well, I hope you enjoyed Carrie and Roger. Senior Center, I think it's the fourth Thursday. Hour and a half they play from 11:30 to 1. You're invited down. Okay, until next time, this is Mike Tillison. I can't. You have a blessed day. Pray for the troops to always win. Never give up.
Yes, we have 5. 2 up.
5, 6, 7, 8, 9, 10. Gray Cat, or also Honey Cat, is doing her exercises. I was doing my exercises this morning on the bed. She came and laid down and started doing her exercises. All she does is flips her tail. 1, 2, 3, 4. Those don't count. You got to get it up all the way up, honey. 6. I'm not counting the little ones. 7, 8, 9, 10, 11. Unless it gets to 45-degree angle, first ball, it doesn't count. She's all tired now. 2, 3, 4, 5, 6, 7, 8. She's moved. Start over. 1. You got 2. You got to get it up a ways to make it count. Hairball. When she gets done with her tail exercises, she'll take a nap. She was irritated this morning because she was laying out by the window. We had lightning, real bright, and then boom. She'd make a comment about it, just about every one. Fuzzball. You know, I've had some requests there for more cat video. More than one request. This is called cat doing tail exercises and she's getting tired. She's not getting tired, she's getting tired of exercising. She probably fails to see the point. All she's getting is some adult talking to her. There she goes. Oh, there goes the plow. Yesterday I was mocking the people who believe in global warming, and now look at today. Got snow and ice out here. Snow is melting. Somewhat pretty chilly though. I'm sorry I made fun of the global warmers yesterday. I shouldn't have done that.
And hello, everybody.
Hello.
Everybody can hear. This is a good thing. But we're not checking your ears today. Today we're talking about eyes.
Hi.
Can you all see me?
Yeah.
How many fingers am I holding up? Oh, you're all in good shape. Bye. I'll see you later here. Okay.
Oh, that was a joke. Is that a doctor joke?
Well, it is kind of a doctor joke, but I want to introduce myself. I'm Dr. Steve Gould.
Oh, good.
I work out at Reamer Eye Center, which is here in town, right across from the hospital. Any of you patients there? All right. Many of you are. It is Dr. Reamer merged a practice. About 10.5 years ago, Dr. Wilberg was an ophthalmologist who was in practice here in Manistee, and he had been here for about 20-some years. Dr. Reamer merged practices. Dr. Reamer has been in Ludington, and he came up here and opened a new office, built a new building, and I joined the practice along with Dr. Wilberg back in 2006. So we've been there a little over 10 years. The practice is getting bigger and growing. We now have an office over in Cadillac. How many of you have been over to Cadillac? We have a big office there. If you think our office here is big, they have an even bigger one over there. And there they have 3 full-time doctors. Here in Manistee, I am here 4 days a week. Dr. Reamer comes 1 day a week. And Dr. Wu is in Manistee 3 days a week. And that's our staffing here at this point in time. Dr. Wu and Dr. Reamer both work in the Ludington office and in Manistee. Dr. Wu does general practice, cataract surgery, treating glaucoma, treating macular degeneration, but she is fellowship trained in eyelids and facial cosmetic surgery and treating and removing and dealing with skin cancers around the face. So we have that as one option. Dr. Reamer is pretty much straight into the cataract surgery, but he also does glaucoma, treats macular degeneration, and so we're going to talk about several things today. The main topic today is the aging eye. Anybody here have an eye that's older than it was a year ago? Of course we do. And guess what? It doesn't get better, does it? I talk to people all the time that hit that magic age of 40. How many of you wish you were 40 again? Well, I do. I felt better. My knees didn't hurt so much. My eyes worked better. All the time people are coming in going, I'm 42, 43, and boy, I used to be able to read and now I can't. I'm sure all of you remember going through that, right? The changes that go on are all normal. These eyes were never intended to stay the same for 80, 90, 100 years. Some of the things we're going to talk about, and probably the first one we should talk about, because it's really the most common thing with the aging eye, is cataracts. Have any of you had cataract surgery?
Yeah.
All right, quite a few of you. That is probably the most common thing that goes on. What is a cataract? And let's go to talking about the anatomy of the eye. And I apologize, we were supposed to have pictures up here, but that something didn't quite click there, so we don't have the pictures. But what is a cataract? The natural human eye, just behind the colored part, there's a lens. Now that lens is made out of protein. How many of you remember waxing a floor 40 or 50 years ago? What happened to that wax? It
Turned
yellowed.
dark.
Yeah, it turns yellow. It got dark. And then your floor didn't look so good, so you'd strip it off and lay down another layer of wax. The natural lens in your eye, because it's protein, ages, and as it ages, it turns yellow. And that's one type of a cataract. We call that a nuclear sclerotic lens. The lens is hardening and turning yellow. And it'd be just like when you walk around and you have sunglasses on, do you feel like you see as good as you do when you don't have the sunglasses on? No. You need that full amount of light getting in, and so a nuclear sclerotic cataract darkens things. A second type of cataract is called a cortical cataract. And how many of you remember seeing a frosted window and there's moisture and you see the little finger spikes of the frost coming across? That's like a cortical cataract. You get this stuff that's in front of you and you can't see through it, or it glares and gives you all kinds of problems. Those of you that did have cataract surgery, do you remember driving and how glare from headlights got to where it really bothered you? That's because of the cataract. That's the number one complaint. That and just blurred vision that go with cataracts developing. Some types of cataracts take years to slowly grow. Other types, like the cortical, and then there's a posterior subcapsular type of cataract, they can literally change in 6 to 9 months and go from you're seeing good to, boy, I'm really having trouble. And usually you can get along okay in the daytime environment, but it's the driving, especially when it's dark and headlights are on, that really bother you. So if you're noticing things like that, get your eyes checked and see if you do have one of those types of cataracts. Most people get a combination. It's not just the aging nuclear, it's most of the time nuclear and cortical combined. So cataract surgery goes in, they make a tiny little cut on the cornea, which is the clear part right over the top of your colored part of your eye. It's only 2 millimeters in size. It's a tiny little cut. They reach in, they cut a hole in the front of your lens and take out and scoop out all the cloudy stuff. And guess what? They slip a brand new clear one right back in its place. And it is simple. The whole surgery takes about 10 to 15 minutes. You go back home the same day because it's done as an outpatient. You wear a patch for 6 hours, but you take that patch off and guess what? Whoa, I can see. I have to clean my house. I can see dust and dirt that I didn't see before. So it is immediately going to be much clearer and better. And usually they'll do the second eye a week or two later, depending on the surgery schedule. But you are going to be amazed if you have developed cataracts, because it's such a slow process. It's like watching your kids grow up, or your grandkids. If you see them every day, you don't realize how they've grown. But if you're like me, and my grandkids are back in Iowa, and I see them once every 4 or 5, 6 months, every time I see them, I go, my gosh, you've grown another 2 or 3 inches. Well, the cataract is the same way. you don't realize how bad it's getting because it's such a slow, gradual change. You're used to it every day. But for an eye doctor that sees you once a year, we're going to look at you and go, oh my gosh, it's time for cataract surgery. And you may be going, really? Is it really time? And we'll be honest with you. There are certain criteria that we use as to when it's time for cataract surgery. The most common one is your driver's license. Have any of you ever had trouble seeing when they have you look in that machine and you have to read those lines of letters? Any of you ever look at that and go, man, that's getting more and more difficult to see? If you are at risk for losing your driver's license, it's time for cataract surgery. And when you come in for your once-a-year eye exams, that's always checked. And we will talk to you if you're at that stage. One of the things that I'll talk about too is going to be macular degeneration. Not as common as cataracts, but anybody in here have macular degeneration? Okay, not as many. Again, what do you do about macular degeneration? And that's always the first question. But let's talk briefly about what is macular degeneration. On the inside of the eye, in the back of the eye, the retina, that's where the macula is. The macula is the one part of your retina that is the most sensitive to vision. So when you're looking at something, you're pointing that macula at what you're looking at, and the light hits it and you see well. Macular degeneration means that that is breaking down. Nutritionally, it's not doing well. I was joking earlier, I was talking to the lady here about the cookies and the candies and the things that we all like to eat. But when you have macular degeneration, it is a nutritional issue. The macula does not have blood vessels in it, so it doesn't get its nutrients directly from the blood vessels, because every other part of your body is going to have blood vessels coming up to it, dropping off the oxygen and the nutrients, and hauling away the waste products of metabolism. But in the macula, because the vision is so critical, there cannot be a blood vessel running in there, or it would be just like a big line in your vision, and nobody wants that. So God, in His plan of things, has the macula with no blood vessels. It's called avascular. The blood vessels come up close, and there has to be what are called transport mechanisms that carry the oxygen and the nutrients into the center of the macula. And those cells, which are highly active, and they're producing waste products, that waste debris has to be carried away. So when we see someone with macular degeneration, we know that there's a nutritional deficiency, and we start you on vitamins. Harvard Medical School did a 12-year study on which vitamin works the best, because there was a point in time when there was controversy. Nobody knew. Somebody said, eat more carrots. Somebody else said, oh, you need vitamin A. Oh, no, you need vitamin K. It does turn out that there's a combination of things that works the very best. And in this day and age, when we do a routine eye exam and we find that you have early dry macular degeneration, we know that if we start you on a certain vitamin, and it's called Preservision Arids, A-R-E-D-S number 2, if you start on that and take it like you're supposed to, it's going to hold that macular degeneration. It will not worsen. 10 years ago, we could not tell you that. There were many times when if we saw early start to macular degeneration, we knew it's only going to get bad. You're going to go blind. You're going to lose vision. But nowadays, if it's a mild, dry macular degeneration, the vitamins is all you need. But there are different types of macular degeneration, and wet forms of macular degeneration are a different story. And we do treat that at Reamer Eye Center. Have any of you ever had a friend that had to get injections of medicine into their eye for macular degeneration? All right. How many of you remember that liar, liar, stick a needle in your eye thing? How about that? Guess what we're doing nowadays? Yeah, we do have to use a needle. It does get injected into the eye and puts medicine inside. The difference between dry and wet macular degeneration: wet macular degeneration has new blood vessels trying to grow up into the macula because of the deficiency of all the tissue. It's trying to carry oxygen and nutrients in there, so it tries to grow new blood vessels in. It's not a lot different than cracks in your driveway and the weeds come up and grow up. You've all seen that. The medicine that we inject in the eye stops the growth of those blood vessels and makes them shrink down. Just like putting weed killer on the cracks of your driveway, the weeds go away. And people that have to get those injections are usually coming in once every 6 weeks, and they have to have yet another injection. But we do testing to see if you come in and you've had 3 of those injections in a row. We do some testing to see, is it held, is it controlled, or do we need more injections? They do not do the injection if there has been no regrowth of those blood vessels. The problem with those new blood vessels that grow in, they're new, they're fragile, and they can break. And if they break and bleed, your eye fills with blood, and you're going to lose your vision. So understand that macular degeneration nowadays is very treatable. First of all, if you are in once a year for your checkups, the vitamins is going to control the dry form. The wet form, which used to mean you were going blind, is also now treatable. So with that, those once a year checkups are so very, very critical. Even when you think you are doing just fine and that you see well, those checkups can catch these things early when it's easy to treat, just like with the cataracts and things like that. Now, we'll also talk about one more thing. Anybody have glaucoma? I knew these two did. I already talked to them. But what do you do for glaucoma? And what is glaucoma? So let's talk about what glaucoma is. And I'm an Iowa farm boy, so I kind of put things in common terms here. Glaucoma is a plumbing problem. The eyeball has a gland inside that will produce and pull the clear fluid out of the bloodstream and pumps it to the inside of your eye. That's how your eyeball stays expanded, just like blowing up the tire on your car with air pressure. Your eyeball has a fluid pressure. Well, that fluid, the pump that produces it, is not pressure sensitive. It's a pump. It's going to keep pumping no matter what at the same rate. There is a drain system in the eye, and that drain can clog up. How many of you have drains at home that have clogged up? We all do, and the eye is no different. Diabetics are much more likely to develop glaucoma. Why? High sugar in their bloodstream, and sugar is a very large, sticky molecule, and it's in that bloodstream, and when the clear fluid is pulled out, it has sugar in it. And that clogs up that drain. Think about a big, sticky clog of something going through a fibrous drain system. It clogs it up. So that's why diabetics are far more likely to develop glaucoma. But how do you treat glaucoma? A couple of different ways. Number one, we have people use eye drops, but there's different categories of those drops. Some of those drops work to slow down the drain, or slow down the production of the fluid, and other parts will actually help to stretch open and clean out that drain so it's working better and draining the fluid better. So you lower the pressure in the eye by drops, and they have those two different mechanisms, and you can treat glaucoma with that. But what happens when it just keeps getting worse and you've used this drop and now you're using 2 drops and now you've done this and that? Now, again, with all the technology today, we have other laser treatments that can go in, and they can adjust the laser so it just burns a skim right across the drain, kind of all the gucky, mucky stuff, that sticky, sugary stuff that is all built up in the drain. If they go along with the laser and apply this laser and burn that away, but don't go deeper than just the surface, you've got a clean drain to start over. So that is called a selective laser trabeculoplasty. And I don't know if any of you have had that done, but that is a great way to clean off that drain and get it open and working again. So very good things can be done nowadays. You've had that? Yeah.
But it didn't work, I think.
Didn't it? Okay. Well, it's one of those things that there's always going to be complications. There can be more than one thing going on. So these treatments usually do work when they're done correctly. But I will just tell you that it's a day and age where they're doing things that we never dreamed about doing. I see a familiar face back here that probably remembers a lot of things that were done in days when, yeah, if you had glaucoma, it was kind of like, sayonara, this is not going to go well. But the drops, the laser treatments, and now they're even developing what's called an eye stent. So if you are a glaucoma patient and you are needing cataract surgery, when they do the cataract surgery, they can put this little stent in. And what that stent is, it's a little piece of metal, but it recreates an open drain that won't clog up. And they're using that now. We've had probably, I don't know, 50 or 60 patients have that. And they can many times either stop some of their drops or get off of them completely. And boy, is that nice, because who likes copays on medicine? Anybody? No. So if you can have a surgical procedure done and get off of the cost of those medications, it's a wonderful thing to do. All right. Okay, you got a question?
Do eye vitamins work for glaucoma too?
Very good question. Do eye vitamins work for glaucoma? The answer is no. Yeah, the eye vitamin is only for macular degeneration, but that's a good question because there is confusion about that. And there are vitamin companies that sell vitamins that they claim will make your cataracts go away. There's vitamins that will treat glaucoma. I will tell you, and my wife is very much into the homeopathic, do things the natural way if you possibly can. But there are no vitamins that treat glaucoma. There are no vitamins that make cataracts go away. It is going to be a natural process, and you might be able to slow the process, but you're never going to make them go away with vitamin therapy. Only macular degeneration. Thank you. That's a great question. Any other questions? Yes?
After cataract surgery, it's been like 3 or 4 years, and I still get like a blurriness over my eyes part of the time. Is that?
Okay, her question was, after cataract surgery, she will occasionally get a blurriness that will kind of come across the eye. That can be from several different things. There is, as we get older, a posterior vitreous detachment that will occur. Everybody, if you live long enough, will have that happen in both eyes. What is a posterior vitreous detachment? The vitreous membrane is the liner on the inside of the eye, and it's attached firmly in the front and a little bit firmly in the back. But everywhere else, it's just kind of tatted in place. It's not secure. And as we get older, it starts to come loose. And during cataract surgery, because there is a little bit of tugging and pushing on the eye, that extra little effort will make the posterior or back surface attachment come loose. And then you have this tag of tissue floating on the inside of your eye. And it will come and get in front of your eye, and then it'll go away. And it's only when it's in the beam of light going through your pupil right back to the macula that you see it. If it's down below, off to the left, up above, or to the right, you don't see that little tag of tissue, only when it gets in that beam of light. So that's traditionally what comes and goes as a blurry spot. Any other questions? Yes, Bob.
Yeah, well, I haven't seen it lately, but there's like a spider would go across,
Okay.
or a piece of thread that would have been cut. I guess it's no big deal. What is that?
He's talking about, again, sometimes seeing a little spidery looking thing. You can have a couple of things. When that vitreous membrane pulls loose, occasionally it will break a blood vessel, and then you'll have this kind of spattering of blood in the eye. That may or may not go away.
I haven't seen it in a long time.
Yeah, and it may simply be that posterior vitreous detachment. It can look different.
I think it's like down here or something like that, but it's not like right there.
Yeah. The thing I will tell you, if you ever have a concern about what you're seeing, the little shadowy thing, lines, whatever, you really just need to get your eyes dilated and have somebody look inside. Because don't worry about things that you don't need to. Who's got enough worry in their life already? Man, we all do. You don't need to worry about things if it isn't necessary. And a good eye exam is going to give you the answer for what you're seeing. And the only time you would need to worry about it is if it was a broken blood vessel or a torn retina, because those things can be fixed. And it's just one of those things that don't worry about it. Diabetic situation. Let's talk about that a little bit. How many people diabetic? Okay, the rest of you that are and you're not holding your hand up, I know you want more cookies, don't you? Yeah, okay. Here's what I'll tell you. Diabetes is probably the #1 cause of blindness in the United States. It didn't used to be that way. What has made that happen?
Sugar, sweets.
Sugar and sweets, thank
and
you.
also pop.
And pop, yes, exactly. Our American diet is not what it used to be, is it? How many of us, pull dinner out of a frozen dinner package and pop it in the oven and eat that, and you pull something out of a box and you make it and you eat it? It's all very processed food. When you have processed foods, you're not getting food in its natural whole form, and it does affect your ability to turn it into the energy and the nutrients that your body needs. And many times, highly processed foods are not going to give you the nutrient value that you need. Most of it's been kind of soaked out of it. I mean, anytime you can have food and have it sit on a shelf for a year and it's still okay to eat, do you think it's got the nutrient value in it anymore? It's not fresh, it's not whole food.
I call it plastic food.
Plastic food, yeah, but this is what we eat because #1, it's less expensive and it's easy. And that's our American way. We want things that way. But with diabetes, what happens in diabetes, and this is one of the things, this is probably the thing that we treat the most at Reamer Eye Center. When you're diabetic, what is going on? What is the worry about your vision with diabetes? The eye is the one place in your body you can look in and see the blood vessels in their natural state. You don't have to inject dye. You don't have to do a CT scan. You don't have to do something. We can see the blood vessels in their natural state. With diabetes, the blood vessel wall, and its job is to keep the blood inside but let the nutrients and oxygen and the fluids get out to the tissue and then absorb back into the blood vessel wall the bad waste products. Diabetes with a high sugar level affects the permeability of the blood vessel wall. So now fluid that shouldn't be leaking out starts to leak out. Sometimes blood comes out, and sometimes you start to grow new blood vessels in areas that you're not supposed to because the blood vessel wall is going, what's going on here? I'm out of balance and I'm springing a leak. So it's very important in the once-a-year checkup for diabetes to come in and let us look inside your eye. Because we can see the fluid leaking, we can see the blood leaking, we can see new blood vessel growth. And guess what? That's all treatable. That doesn't have to go into blindness. So if you are diabetic, #1, get your once-a-year checkup. #2, if you get told that you have diabetic retinopathy, and you Google it and it talks about going blind, don't worry. Again, don't worry about things you don't need to worry about. Just get it checked, make sure that the treatment is correct. A simple laser treatment many times takes care of that. And it's just a matter of doing what you have to do. We all have cars, right? What happens if you don't maintain them? Yeah, they don't work very well for very long, do they? So your eye is no different. Everything in our day today is visually led. How did you guys all get here today? You either drove, you walked, but without your eyes, you wouldn't be doing the things that you're doing. Even if you couldn't drive, what do you do at home? You read, you watch TV, you bark, things like that. You've got to know everything that we do is visually led. The #1 thing, the one sense that you lose that is the most difficult and leads people into horrible depression is losing their vision. That is so depressing to people because you've lived your whole life understanding things from a visual perspective. The things you do, the things you like to do, your ability to get around and go visit people and see things, it's all visual. And it doesn't have to be lost if it's maintained correctly, which are once-a-year eye exams. Now, anybody have any more questions? Yes.
I would like to know when an older person comes to your office for the first time, are you giving them 3, 4, or 5 tests, all these different tests? That's what really bothers me, because nowadays the co-pays are out of sight. So it is very important that you know ahead of time how many tests you're gonna have.
She asked a very good question. If you are a new patient coming in for an eye exam, are you automatically going to be given every test in the book? And the answer to that, if it's done correctly, is no. There's a basic exam, dilating the eye, checking the pressure, checking how you see. And if you do well on that, that's it. Now, if in the dilating of your eye process or checking the pressure, we note that your pressure is way high and it's likely glaucoma, then yes, they will do these other tests. Or if we dilate your eye and look in and see diabetes or see macular degeneration, then yes, there will be other tests. But that's not going to be automatically scheduled unless there's a reason. You know, in order for it to work correctly, you have to have a diagnosis before you can, in the medical world, if you don't have the diagnosis, you really cannot, you can't get paid for doing the test, let's put it that way. So they're not going to do anything that's not necessary. Any other questions? Yes, Bob. Mike.
When I was a kid, I went to an eye doctor, old lady. She was really old. She was probably 60, I don't know.
Ooh.
I was a kid.
Yeah, at the time, yeah.
And she looked at my eye and she said, she told me all kinds of things about your blood vessels. And she said, I was going to probably have a stroke or a heart attack. And I asked my parents, they said that she's just a little quack. And I never did, but what can you tell by looking at the eye, like what you're talking about right now? What are some of the things you can actually tell that's real medicine? It might have been, at the time, maybe I was heading that way and it's changed my lifestyle, I don't know.
The question was, looking inside the eye, he was told, gee, you might have a stroke, you might have this, you might have that. Let's go back to my earlier comment where I said when you look in the eye, it's the one place in your body you can see the blood vessels in their natural state. Blood vessels, let's just use high blood pressure as an example. With high blood pressure, you have an artery and a vein that usually run side by side, and there's a difference in their size. And when your blood pressure is getting high, that artery is getting smaller and smaller, and so the size ratio changes from a 1 to 2 to a 1 to 3, or some change in size. Also, let's talk about cholesterol. What happens with cholesterol? That blood vessel, the artery in particular, will change color if your cholesterols are running high. And we will look in and see that, and many times I'll ask a patient, well, do you ever have trouble with your cholesterol running high? And they go, gee, yeah, how did you know? My doctor's watching me for that. It's because of the change in color. And then the other things that can happen too, when the artery and the vein cross over each other, if you have hardening of the arteries, that artery, when it goes over the vein is softer, and you'll see it pinching. You know, if you've ever pressed down on a soft plastic tube, how you'll see it narrow down. You'll see that, we call it nicking, but you'll see changes like that. So anything that affects your vascular system can be picked up by looking in the eye. They must be getting ready for lunch here, I tell you. So, all right. Any other questions? These are great questions. Thank you.